Hi, this is Donna Hazelwood, Class N95 Nursing Assessment. This is my patient. This is Clanton Hazelwood. I will ask him, do you give verbal permission to participate as a model in this assessment assignment and be recorded for school purposes for Aspen University Class N495?
Yes.
This assessment is intended to show my skills with the assessment actions only and is not to be used as direction for your health status or follow up with any irregular findings. Do you understand this?
Yes.
Okay, so I'll begin with the initial assessment of obtaining a set of vital signs. I don't have any equipment with me, so I'll explain that a temperature gauge would be done with a tympanic thermometer, which is started on the one side of the forehead and swept across the forehead for a Celsius reading. The pulse would be recorded radially, normally 60 to 100 for an adult. Respirations and O2 saturations would be visual, and oxygen saturations would be done via a oxygen pulse oximeter. Respirations anywhere from 12 to 20 is considered normal. SpO2 sats, anything greater than 93% is considered okay. If less than that, then oxygen would be considered. Blood pressure would be applied to the either forearm just above the antecubital, pumped up to about 200. The first time the pulse is felt is the systolic. The second time it's felt is the diastolic. Anything between 120 and 70 is a normal range. Anything above that would be considered either prehypertension or hypertension. I'm going to assess pain at this point. Are you having any pain?
No.
Okay. If this person was experiencing any pain, I would ask them to tell me the characteristics of the pain, such as the location, if it's chronic, if it's constant, or if it comes and goes, and what level of pain it is on a scale of 1 to 10, and what type of pain. Some examples would be ache, dull, tender, pressure, and if it is a chronic pain or not, and if there is any intervention necessary for pain medication. So now we'll start with the assessment portion of the assignment. And I will start with the expected professional behaviors. I will wash my hands in front of the patient. I will have all of my equipment together, which in this case, the only equipment that I have since I'm not at the hospital is my stethoscope. I will introduce myself and the role and purpose of this assessment. And my name is Donna. I'm your nurse. I will be doing an assessment to determine the cause or the reason for your visit. I will ask you to identify your first and last name
Clanton Hazelwood.
and spell your last name.
Hazlewood.
And what is your birth date?
9160.
Okay. And I will just do a general survey and ask him his mentation questions. He's told me his name. Can you tell me where you're located?
Camp Verde, Arizona.
What time is it?
It's 1:15.
Okay. And then do you know what's going on?
Yes.
Okay. Can you tell me what's going on?
Being assessed.
Okay. All right. So at this point, I'm going to assess the head, the face, and the neck. I will look at the structures of the head. I'll look on the forehead to see if there's any breakage in the skin, if there's any infestations such as lice, which I do not see any. I'll palpate the head to see if there's any masses palpated, and there's not. I will also check the carotid pulses individually, check with on the other side. I feel them present. I will check the temporal, and they are present. I will assess for TMJ. Go ahead and go like that. Okay. I'm checking for TMJ, which is a clicking at this area right here that would indicate that that is present. It's not. I would also assess the area of the trachea for enlargement of the thyroid on either side of the trachea. I do not feel anything present. And I would also check to see if the trachea is midline, and it is. I'm going to assess the facial sensation. Have you clenched your jaw? Okay, and that is present. I will ask you to raise your eyebrows. I will ask you to close your eyes tightly. And I will ask you to smile and frown. Just, okay, just make it, okay. All right, and those are all present. I'm going to look at speech quality at this point, and I'm checking for the hypoglossal cranial nerve. Can you say light,
Light,
tight,
tight,
dynamite?
dynamite.
Those are all present. At this point, I'm going to palpate and check the cervical lymphatics. The areas that I will be checking are going to be, and this is kind of a small area, but I'll try my best. I'm going to check the auricular area, which is the area just in front of the ears, for any lymph nodes, and behind the ears. And that's perfect. I'm going to check the occipital, which is the back of the head. I do not feel anything abnormal. I'm going to check the retropharyngeal area, which is right here on either side, and I do not feel anything abnormal. The supramandibular, which is going to be right up under the jaw here, and that is, it's in good shape. The submental area is the area it's in the chin area. The sublingual area, I do not see. And the I'm going to feel up here. I'm going to feel back here. Everything is intact with the cervical lymphatics. I'm going to inspect the skin. The color of his skin is nice and pink. The moisture is dry. His skin is warm. His skin turgor, he does not have any. His cap refill is present. It's less than three seconds. And I do not, on assessment of his lower extremity, I do not assess any edema present in his ankle area. I'm going to look at the cardinal positions of gaze, which is, I'm going to have him look up, look down, keeping your head straight, look to the side, to the right, look to the left, look down to the left, look down to the right. Okay, everything is in place there. And then I'm going to do a confrontation test, which is I'm going to put objects into his view and make sure that he can see them. So do you see my hand over here without moving your head?
Yeah.
Okay. How about now?
Yes.
Okay. And how about now?
Yes.
Okay. That's in place. Okay, I am going to do a corneal light reflex, which is I'm going to look at assess his pupils to see if they are even in size or if there's any abnormalities noted. So I'll be doing that. Look straight ahead. Pupils are equal and reactive, and there are no changes in the size of his pupils. And I don't have a pen light, but I'm going to assess for PERLA, which is equal round, reactive to light, and response. His pupils are about a size 2. They're equal and responsive to light. I'm going to check the external structures on his ears on both sides. There's no breakage in skin. They're intact. Is there any tenderness on your ears on either side?
No.
Okay. And I'm going to, if I had an otoscope, I would look inside his ears to see if I can note any redness, any fluid present, any wax buildup, anything that would denote that there could be a potential issue with his ears. I don't have that, so I am unable to assess it, but that's what I would do if I had the equipment necessary. Now, on the sinuses, I would be assessing the maxillary and frontal sinuses for tenderness, which on the sinus area, it would be this area here, which would be right for any tenderness. Do you have any tenderness?
No.
And then I would also palpate right here for any tenderness. Do you have any tenderness? Okay, so it's all in place. And then I would also inspect his nose. There's no breakage in skin. There's no drainage from his nose. He appears to be normal on his nasal passages. If I had a light, I would shine a light up into his nose to see if there's any redness, any edema noted. I'll have you open your mouth. Stick out your tongue. Okay, and I do not notice any breakage in the skin inside his mouth. His tongue is moist, his teeth are in place, there are no sores present. If I had again, a light to check, I would see if he had his uvula rose by having him say ah. I'm going to assess his breathing. I do have a stethoscope, so I will be checking for his breathing. Seems to be with no distress, in a range of 16 and equal. I will also check for tenderness to the 4 areas on his chest. On palpation, do you have any tenderness?
No.
Okay. I am going to place my stethoscope on his chest in 4 areas and ask him to say 99. Can you say 99?
99.
Say again.
99.
One more time.
99. 99.
Okay. That is in place. I'm going to check his chest in the back to see if there's equal rise and fall and movement of air in the lungs. Sit forward a little bit. Take a breath. Okay. Again. Again. And one more time. Okay. Everything is normal. All right, there's no crackles, rhonchi, wheezing that it's noted. I'm going to use my stethoscope. I'm going to assess his carotids for any bruits present. Look this way. And look this way towards me. There's no bruits palpated. He does have breath sounds anterior and posterior. I'm going to be assessing for heart sounds. There's 5, 6 areas that I'll be looking at. So I'll be checking here, 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 and here. I'm checking for S1, S2, S3, and S4 and murmurs in those 5 areas that were just palpated. I did not hear any sounds when I did that assessment. I'll check his belly for any bulges, pulsations. I do not feel anything present. He does have bowel sounds, of which I would do with my stethoscope, listening. Belly sounds are present. On the extremities, I would inspect and palpate the joints for movement, his wrist, his elbows, shoulders, his knees and ankles. All range of motion is normal without any signs of distress. I would palpate his radial pulse, the dorsalis pedis, which is to the side of the foot, and his pedal pulses, which are on the very top of the foot, and they are all present. When this person came to do his assessment, I observed that he was able to walk without any issues, and he had no abnormalities there, and he had proper balance. If I had a reflex thing, I would check for his deep tendon reflexes by tapping on his elbow and tapping on his patella area, and those are all normal. And then Final thing that I'll ask you to do is to raise up your hand and touch your